So this other study, well, it's a totally different study in which we focus on blood biomarkers for Alzheimer's disease. So we measured several AD blood biomarkers in this same population, which is comprised of cognitively unimpaired participants at risk for the disease. So we measured amyloid beta 40-40 ratio in plasma and different isoforms of phospho-tau, which include 181, 217, 231, also GFAP, total tau, and neurofilament light. And we were testing here how these different biomarkers in plasma at baseline, how they predict cognitive decline in these participants, even though they are still cognitively unimpaired objectively. And we found that plasma p-tau 181, total tau, and plasma p-tau 231 especially associate with cognitive change after a 3 years follow-up in those participants that have amyloid positivity at baseline. So those that are, we can say that they are already within the preclinical stage of the disease. Furthermore, in this study, we also analyze a group of participants that we call the decliners, in which we define them as those that show a steepest cognitive decline compared to the mean of the group mean. And we also found that p-tau 217, 181 associated also with cognitive decline in this particular group of participants. These results were just published yesterday in Nature Medicine, actually. This poster presentation was a kind of a follow-up of these results included in the paper. And in the paper, what we find is that plasma p-tau 231 and 217 are those biomarkers in plasma that seem to be increased in the very earliest stage of the disease with very little or subtle amount of amyloid pathology. And they are increased in individuals with low burden of amyloid pathology. They are also increased in a very lower levels of centiloids, so of amyloid deposition in the brain. And they also are those that are more associated with amyloid deposition longitudinally after 3 years. And as I was saying before, also with cognitive decline after 3 years. So these are, our main finding is that plasma p-tau 231 and 217 seem to be state biomarkers very accurate in the very early stage of the preclinical phase. At the moment, we are working on precisely further analyzing this longitudinal data. We so far had cross-sectional data, so now we are analyzing this cognitive decline and also this longitudinal data on amyloid deposition and other variables to further study how these different biomarkers can predict that. We are also interested in sex differences on these different associations. So at the moment, I am particularly working on that. And as I was saying, also, we are interested in studying the effect of comorbidities and different factors on these biomarkers also.